My name is Amy Kingman. I'm one of the cardiologists at Central Georgia Heart Center. I have been with the practice close to 15 years now. I came from Miami and have found that Macon is a good home for myself and my family. I am a general cardiologist, which means I do a lot of different things. I do heart caths, I see patients, I read stress tests, I do transesophageal echoes, and recently I've acquired a new skill set that I've been applying in our vein center, which is working on venous insufficiency for patients who have leg pain and swelling. I also have an area of interest in women's heart disease and dyslipidemia and prevention. So I like to think I can wear several different hats and meet any needs that our new patients or old patients may have. I began being interested in vein disease about 2 to 3 years ago. For a long time, we've been referred patients to evaluate because of swelling in their legs. Primary physicians think that may be related to heart failure, and that's an important thing to rule in or rule out as a possible diagnosis. And so we usually start by evaluating patients with ultrasounds of their heart. If their heart is strong and they don't have any structural problems that would lead to the swelling, patients become frustrated at times and don't know, they're happy their heart is doing well, but they really don't know what is the next option to explore. And so that just kind of led into some training. I've been mentored by a physician in Birmingham, as well as 2 of my partners in the group, and we've recruited some excellent staff to support us in this endeavor. We have a special ultrasound technician who can identify vein disease, and then, these treatment procedures are office-based and only take about 45 minutes, and patients walk in and walk out and feel like a new person. So we check out their heart. If it's okay, leads us into the veins, and then if we find a problem there, we can often make them feel better. About 20% of women have vein disease and 15% of men, so it's not gender specific. It's very common. There's just really a wide gamut of the way people present with vein disease. You can think there are very healthy people like weightlifters that are in good cardiovascular condition, but they have vein problems which are completely unrelated to the heart. So they might need to seek my care even though they are cardiovascularly in good shape. And what happens is they do a lot of heavy weight training and they put a lot of stress on their veins. And they can develop varicose veins or a lot of valvular problems in their veins where the blood pools in the veins and leads to a lot of discomfort and swelling in the legs. Also, women who have multiple pregnancies put a lot of stress on their veins. Carrying babies causes a lot of increased circulation. Your cardiac output doubles. There's a lot of circulating blood volume, and then there's a lot of weight and pressure in the abdomen from carrying the baby that translates to pressure on the venous system and can cause congestion of the leg veins. So a lot of women who I will see in the vein center say that they first notice they develop spider veins or varicose veins with their 3rd pregnancy, and they really never realized there was something they could do about it that didn't require an extensive operation. And so they're very happy to hear that the procedures have evolved and they're not taken away from their family for prolonged hospitalizations or recovery time. They come in, get a vein treatment, can drive themselves, and are back on their feet the next day. So as you can tell, there's just really a wide gamut of individuals, both men and women, young and old, healthy and sick, who can be affected by vein disease. A lot of individuals have a lifelong dream of becoming a doctor. In my case, my path was a little bit different. It was the first thing that I pursued out of college, so I went on the physician track right away. But I didn't grow up with physicians in the family or just having a sick relative that, led me down the path of healthcare. Fortunately, I did well in school. I volunteered at the hospital in the neonatal intensive care unit and was really struck by the sadness of families, dealing with sick children, and just realized how fortunate my family had been not to have had a lot of suffering or illness in that we had personally experienced. You are influenced by mentors, and so when I graduated Chapel Hill, I went back to my hometown of Maryland for medical school. When I graduated, I took a job in Miami. That was a good learning experience, but not the best fit for me long term because there was a language barrier there. But it did open my mind to important things in a medical practice, and some of those things are just working with people you respect. My training includes undergrad at University of North Carolina in Chapel Hill, medical school at University of Maryland in Baltimore. Then I returned to Chapel Hill to do my medicine residency and my internship. And then after that, I went to Medical University of South Carolina in Charleston for my cardiology fellowship. I'm really proud to be a member of Central Georgia Heart Center. It's been a good place for me.